Welcome to the Ventilatory Management Skill Station. These progressive skills are designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to an apneic adult patient who has no other associated injuries. This is a non-trauma situation and cervical precautions are not necessary. You are required to demonstrate sequentially all procedures you would perform, from simple maneuvers and adjuncts to endotracheal intubation. You will have 3 attempts to successfully intubate the mannequin. You must actually ventilate the mannequin for at least 30 seconds with each adjunct and procedure utilized. I will serve as your trained assistant and will be interacting with you throughout these skills. I will correctly carry out your orders upon your direction. Do you have any questions?
I do not.
Upon arrival to the scene, you observe the patient as he goes into respiratory arrest and becomes unresponsive. A palpable carotid pulse is still present. Bystander ventilations have not been initiated. The scene is safe and no hemorrhage or other immediate problems are found. Do you have any questions?
I do not. BSIP, my scene is safe. I'm going to manually open the airway with the head tilt chin lift. After the airway is open, I'm going to measure for the correct size oral adjunct. Looks like I have the right size OPA right there. I'm going to elevate the tongue and insert the OPA into my patient.
No gag reflex is present when the patient accepts the adjunct.
Okay, I'm going to assemble my BVM and start ventilating the patient.
Ventilation is being performed without difficulty, but pulse oximetry indicates that the patient's blood oxygen saturation is 85%.
Okay. Take one more breath, and I'm going to connect to oxygen at 15 liters per minute. I'm going to continue ventilating my patient.
Breath sounds are present, equal bilaterally, and medical direction has ordered intubation.
Okay, I'm going to have my partner over here take over ventilations and pre-oxygenate the patient. Okay, at this point in time, I'm going to check my equipment for intubation. All right, I've make sure that I've got my different selection of ET tubes. I think I'm going to go with size 8 here. Connect this, inflate the bulbs. Check for any leaks or cracks. I don't hear anything, don't see anything. I've got a stylet. Make sure the stylet is sized correctly. Going to move the air out of there. Connect the blade. Make sure I have the right size that I need. Make sure that the light works. It's right, tight, and bright. Leave that there. And I've got a tube securing device and my stethoscope. Okay, when I tell you, I want you to remove the BVM and the OPA from the patient. So after your next breath, go ahead and remove the BVM and the OPA from the patient. Okay, I'm gonna get my laryngoscope and position the head. Place my laryngoscope in there. Lift the tongue out of the way. Got my tube. This is 8, so 24 of the teeth. I'm gonna inflate my tube, move the stylet, and can you place the bag on the ET tube? Good breaths. Good. Keep that secured. While she's holding the tube, I'm going to check for sounds over the epigastrum and breath sounds in all 4 quadrants.
If you had proper placement, what would you expect to hear?
I would hear no sounds over the epigastrum and equal bilateral breath sounds. So I got equal bilateral breath sounds, no sounds over the epigastrum. At this time, I'm going to secure my ET tube. So you go ahead and I'll take this right here. I'm going to slide this in here. My ET tube is secure. Continue giving breaths, 10 to 12 breaths per minute.
Please demonstrate one additional method of verifying proper tube placement in this patient.
I could use entitled CO2. So I would use my entitled device so I can remove the bag from here, place the entitled back on, place the tube on, give breaths, and connect to a monitor and make sure that I am obtaining a proper, correct entitled CO2 waveform on the monitor.
You see secretions in the tube and hear gurgling sounds with the patient's exhalation.
Okay, I'm going to instruct my partner to pre-oxygenate the patient while I select the correct size suction catheter. While she's pre-oxygenating, I'm going to measure for the length for suction. And so I have approximately the correct length. Mark that. I'm going to have you remove the BVM and the entitled CO2, and I will suction the patient. Okay. So, place suction. And I will only suction on the way out. Okay. And once I've suctioned the patient, I will put the BVM back onto the patient. I'm going to have my partner do that, and I will cleanse the catheter with sterile water.